Welcome to Wednesday's edition of COVID-19. The fourth wave here is pushing our daily tally to frightening levels. In fact, Korea has marked a fresh high today with the tally above 1,600 new infections. Now, having said that, we start now with the pandemic updates with our Kwon So-ah. Now, So, you predicted a greater number for this Wednesday during our talk yesterday, but I really wasn't expecting the surge.
Sunny, you're definitely not the only one here. We're having an unprecedented figure for Korea. It's the fourth record high in daily cases we've been seeing since last week, that is, and the biggest spread since Korea's first ever case was reported early last year. Now, although a rise was expected, given that it's the middle of the work week, many have not expected it to be to this amount, which is 1,615 cases as of 12 a.m. With that, domestic transmissions have also hit an all-time high, standing at above 1,500. So it was last Wednesday when figures have started to surge to over 1,000. So for the 8th consecutive day, we are at this level. And just a month ago, the Wednesday figure was in the 500s, and we are definitely seeing a gradual increase in daily COVID-19 infections. So with that has raised Korea's total now to 171,911, and 2,048 is the death toll, with 2 additional fatalities reported in the past day. And if we go over to our map, around 75% of cases were confirmed in the capital region, with surges in Seoul, Gyeonggi province, and Incheon. Now here, over 600 infections in the capital, but also a concern down in the south, 89 in Gyeongsangnam-do province, 63 in Busan. So in all 17 provinces or major districts, we are seeing an increase in infections.
Right, So, and in light of the surge in cases nationwide, I understand social restrictions outside of the Greater Seoul area have also been raised.
Right, Sunny. While Seoul, Gyeonggi province, and Incheon continue to be under level 4, the toughest social distancing measures until the 25th this month, the 2-week transition period of the revised social distancing scheme, which was revised from a 5-tier to a 4-tier system, is coming to an end this Wednesday. So under that, non-capital regions have mainly been under level 1, but the government had to make the following decision for the upcoming 2 weeks beginning Thursday.
The average number of cases outside the capital region has doubled compared to last week. Beginning tomorrow, level 2 social distancing measures will be enforced across the nation, apart from Sejong City, Jeollabuk-do province, Jeollanam-do province, and Gyeongsang-buk-do province.
So under level 2, the rule is up to 8 people can gather for private gatherings, but local governments are free to implement their own individual measures according to their virus situation. That's why a number of districts have decided on stricter caps of up to 6 or up to 4 people only. Also, nightlife entertainment venues, restaurants, coffee shops, and most other public use facilities will have to close at midnight according to level 2. Authorities, meanwhile, say that the effects of enhanced social distancing start to show a week after implementation, meaning for the time being, cases are likely to rise, calling on extra strict abidance to antivirus guidelines. And amid the surge in infections, there are growing concerns on the speed of vaccinations, especially over the supply of vaccines for those in their 50s, as many have failed to make their reservation earlier this week. Now, authorities said that another round of bookings for those aged 55 to 59 will open beginning this Wednesday at 8 p.m. Korea time, adding that an earlier closure of the reservations was due to administrative problems.
Moderna vaccines being delivered in the 3rd quarter will be in enough quantity to provide 2 doses for people in their 50s. There will be enough supplies for everyone in this age group who wishes to get vaccinated.
Now, vaccination reservation for those aged 50 to 54, meanwhile, is expected to start on the 19th, but that's also going to be divided into smaller groups to avoid congestion on those reservation websites. So on the 19th and 20th, that age group is expected to make their reservation, and the actual inoculation for those in their 50s is to kick off on July 26th. And here we are seeing the number of people who have already gotten their shots. We've got over 105,000 now. We just spoke about Indonesia, which now is the country with the 15th highest number of cases, having just surpassed the total caseload of Mexico. And also Spain has hit 4 million infections, now seeing resurgences due to the Delta variant there. And we're also seeing over 40,000 infections in the US, India, as well as Brazil. And the total number of cases around the world stands at 188.5 million, with over 500,000 cases reported in the past 24 hours as of noon Korea time. And those are the updates I have for now. Back to you, Sunny.
All right, so as always, thank you very much for that. Right, it's time now for a closer look at the COVID-19 related developments here on the local front with our Ji Abby Lee. Welcome, Ji.
Hi, Sunny. A week sure goes by fast, but faster if you're keeping up with the news about the record-breaking infection rates here in Korea, just as Soa mentioned earlier. So today, let's talk about the patterns of the transmissions in the capital region, as well as the sharp decrease in fatalities among those over the age of 60. Cluster infections continue to happen in restaurants and bars among what the KDCA calls an age group with active social lives. What's behind the spike in the COVID-19 infection rate are underground venues with poor ventilation, close contact among service providers and customers, and people visiting multiple establishments even after symptoms start to show. The KDCA has doubled down on its recommendations to the younger generations to get tested at the multiple free testing sites around the country, even if they're not showing symptoms. At the same time, the agency appears quite aware of the growing friction between the older and younger generations. With dining and nightlife activities by those yet to be vaccinated fueling the rise in the infection rate, those in their 20s and 30s have voiced their frustration over the recent negative stereotypes. Korean health authorities also spoke about this stigma against young people.
아울러 이런 결과들은
These findings should not be misunderstood as issues that are specific to a certain generation. The outbreak has nothing to do with any particular age group, and risk factors should be evaluated objectively in order to curb the spread of the virus.
Right, and I believe authorities here are seeking to better deal with the spread of the Delta variant, Ji.
Absolutely. So Seoul is trying out a new system to ramp up its already robust COVID-19 testing capacity. For 2 weeks starting tomorrow, local governments will have the authority to conduct selective PCR tests to estimate the spread of the Delta variant. After that, the KDCA will go through genome analysis on the test results.
I see. Meanwhile, Ji, on a positive note, I hear inoculations of the elderly have kept this particular group protected from the virus. Tell us more.
That's right. So this is something the KDCA has also elaborated on during the briefing. Here's what the director Lee Sang-won had to say.
60대 이상 인구 집단에서는
Among the elderly aged 60 and above, total infections, fatalities, and the number of patients in critical condition have all declined following an increase in the vaccination rate.
Among those over the age of 60, the infection rate has been steadily declining since May. By the first week of July, when more than 88% of the people in that age group had received at least one vaccine dose, the infection decreased to just 3.5 infections per 100,000 people. Among the elderly, some 3,900 cases were confirmed in May, but over 90% of those patients either did not get their shots or had been vaccinated for less than 2 weeks. Even with a single dose, vaccines can lower the rate of serious illnesses by 23% and the fatality rate by 72%. I'm sure a lot of our audience teaching English here in Korea are curious to know about the vaccines that are available to teachers. If you're teaching 3rd to 6th graders in elementary school and middle school, you're now eligible to make your vaccines appointment. Online bookings for the Pfizer vaccines will be open for 4 days starting today, with inoculations set to begin on the 28th. That's all for me today. I'll be back next week.
All right, as always, thank you very much for the coverage.
Pleasure to be here.
Right, on the international front, Myanmar's COVID-19 plight remains an alarming reality under its military rule, with people there wary about the junta's handling of both the pandemic and politics, to say the least. For more on the situation there, I have Andreas live on the line. Welcome, Andreas.
Thank you.
Right, Andreas, let's begin with the public protests against the junta military. I hear the crackdown on civilians continues there.
Right. Of course, the crackdown on the protests are continue, and of course, even there was the protest in Yangon this morning, led by women. So the people of Myanmar and the pro-democracy youth, they never give up on the fighting against the military regime. We can see the protests and flash mob protests every day across the country, even though they are arrests of them. At the same time, the young people who are joining the ethnic armed group, they have found a group called People Defend Foes. That People Defend Foes at the same time is fighting against the military troops.
Andreas, against that backdrop, the daily tally of COVID-19 in Myanmar has been hovering at some 5,000 cases in recent days, but many believe the actual number may be way above that number. Could you tell us a bit more about this?
Well, yes. The Myanmar, most of the healthcare workers joined the civil disobedience movement, to show their desire against the military regime since the coup. So at the same time, we don't really have the human resource. At the same time, we don't have many tests. So that's why we are saying that more cases are to be expected, and we have vaccines delivered from India before the coup, and of course we are hearing that we have got some vaccine from China and Russia, but the public don't really have access to it.
Are we talking about the vaccines from Russia would be the 2 million doses that the junta military recently spoke about, Andreas?
Yes.
And the public has no access to this supply?
Yeah, so far, the public has no access to it. And of course, even they don't have, the large access to the previous one delivered from the India.
I see. Meanwhile, Andreas, how are patients of COVID-19 receiving treatment for their disease at medical centers in the absence of medical personnel, as you mentioned earlier?
Well, yes, many people are dying without having the treatment and medical care because they're not able to go to the hospital. And I was told that many patients died on the way. Many patients die at the hospital since they as soon as they arrive, because the hospital they are requiring many documents. They say, hey, you need a document from the local health department, something like that. So people are struggling with it, and at the same time, as I mentioned earlier, there is no enough the healthcare workers at the public hospital and the centers.
I see. So what in general, Andreas, is being done to keep the public safe?
Well, the thing is, people really want to restore the democracy in the country. So people are saying that if we can restore the democracy, the medical doctors, and the medical workers are ready to go back to the work. And also, many of the medical workers are in hiding and are on the arrest warrant, and many of them are being detained and arrested because only they joined for the civil disobedience movement against the military. Then we have seen many crucial movement of them being brutally beaten up on in the street during the protest. So this is the case. The people are worried. What if we cannot really control this surge?
I see. Andreas, before you leave us then, please do share with us a few words about your hopes for Myanmar in the near future.
Well, I mean, as someone who is in the countries and closely covering both coup and the COVID-19, I'm really worried, what is going to be happen, because at the same time I have just visited to one of the oxygen station where people comes and refill their oxygen tank in Yangon. So many people are lining up with their oxygen tank, and on the social media we're seeing that we need the oxygen urgent, and then a moment later the Facebook post say that the patient has been that the patient was expired. So even in my cycle, family member of friends, family member of my colleague passed away during these days. It's really sad. At the same time, we are hearing that we are hearing the news of the arrest of the students, protesters, the politicians. So nothing is positive here at this moment. But of course, everyone is looking for the hope, the brighter future. So I hope near future we will get it done.
I see. All right, Andreas, do stay safe, and thank you for sharing with us the sufferings of the people there.
All right, thanks so much. Yeah.
Right, back on the local front, we share with you efforts by city officials in one area that is seeking to offer psychological support to those who are suffering from the repercussions of the pandemic through a special service using a bus. Do take a look.
It's been well over a year since the pandemic broke out, and just recently, the social distancing level in South Korea has been raised to level 4, causing mental health issues among people. According to the health ministry, the overall depression index in South Korea has more than doubled compared to pre-pandemic times. Also, the number of calls to suicide hotlines in 2020 increased by 53% compared to the year before.
Amid calls for systematic management of Corona Blue, Goyang City in Gyeonggi-do Province is operating a visiting psychological counseling center. And the bus you see behind me is the counseling center. Let's get inside and take a closer look.
The Visiting Psychological Counseling Center, named Todak Bus, began its operation on July 1st. Todak in Korean means petting, which implies petting someone to console. The center aims to provide one-on-one psychological counseling with psychiatrists to those who suffer psychological distress. The counseling process is simple. First, you need to make a reservation, and then you get on the bus, fill in a medical questionnaire about your current health and mental conditions. After that, your brain waves and pulse will be measured to calculate your stress level. Psychological counseling will be mostly based on the questionnaire and the measured stress index.
스트레스 지수 어떻게 나오는지 좀 설명해 주실 수 있을까요?
여기 점수를 보시면 두뇌 스트레스 점수가 되게 높은 편으로 나오셨어요. 그래서 아마 최근에 좀 스트레스 많이 받으시고 고민도 있으시고 정신적으로 좀 지치는 상태를 좀 말하는 것 같습니다. 네. 아무래도 이제 코로나19가 감염병이다 보니까 내가 혹시 코로나19 걸리지 않을까 그런 걱정하시는 분들이 많고요. 또 실제로 경기도 안 좋아지니까 경제적 어려움, 그리고 가족들이 자꾸 모여 지내다 보니까 가족들 간의 다툼 이런 걸로 어려움 겪으시는 분들이 많습니다.
To ensure confidentiality, counseling will be provided one at a time and no record will be left. Each session will last about 25 minutes and it is free of charge. For better quarantine, the counseling is on a reservation basis. What is more, only essential manpower is allowed in the bus, and it will be disinfected at the end of every session.
객관적으로 데이터가 딱 나오니까 내가 이런 상태였구나. 그래서 이런 것들은 조금 추후에도 조금 관리를 하거나 좀 제가 관심을 갖고 내가 나를 좀 돌봐야 되겠다라는 생각이 들었고.
The bus goes anywhere in Goyang City as long as you are over 19 years old and make a reservation in advance. The bus will visit you. However, signing up for the service will be restricted if you're currently undergoing professional psychiatric treatment. The service is temporarily put on hold due to the level 4 distancing measures, but it will resume providing the service as soon as it gets lowered to level 3.
뭐 우울, 불안, 불면 같은 증상이 있으신 분들, 그리고 또 코로나19 때문에 스트레스 많이 받으시는 분들, 그리고 꼭 뭐 증상이 많지 않더라도 그냥 스트레스 체크하고 싶으신 분들도 오셔도 되고요. 또 병원에 가고 싶지만 병원 가긴 좀 부담되시는 분들은 여기 와서 상담을 좀 경험해 볼 수 있을 것 같습니다.
Since last year, the government has provided psychological services to support the general public. Other local governments are also running their own counseling programs, such as the Healing Forest or the delivered outdoor lectures to help people cope with the corona flu.
A lot of people are having a tough time because of the severe economic hardship and limited social gathering caused by the pandemic. In times like these, we should not only take care of our physical, but also mental health. This has been 신세병.
경기 인천의 유치원과 초중고 특수학교는 4단계 거리두기에 따라 여름방학 이전까지 원격 수업으로 전환합니다.
You always want the best for your children, and here too I did not have concern because I was certain that this would be the best solution for my child, for my daughter.
So anyone who's fully vaccinated, they don't need to mask indoors, they don't need to physical distance.
The Delta variant is challenging COVID-19 containment efforts worldwide. And while adults have vaccines to rely on, children remain largely unprotected. For more on this reality and on ways to address it, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Meanwhile, joining the session virtually is Dr. Choi Young-jun at Korea University Medical Center. Good to see you again, Dr. Choi.
Thank you for having me here.
And I also have Dr. Stephen Spector at the University of California, San Diego. Pleasure to have you with us, Dr. Spector.
It's a pleasure to be here.
Right, Dr. Kim, here in the studio, we'll start. Over in the city of Incheon, here in the metropolitan region, a cluster infection at a primary school is receiving much attention because many of its close to 70 cases have been linked to the Delta variant. What are your thoughts on the impact of the Delta variant on the unvaccinated youth?
Well, according to the study actually just reported in the UK, the Delta variant is known to just increase the transmissibility and then hospitalization, even just compared to the Alpha variant, which was actually identified in the UK. And that seems to occur to some older generation, regardless of, the teenagers and then 20s or 30s. And mostly just new infections seems to occur in the 20s and the 30s in Korea right now. But as you said, that also infection is actually just is now reported on the children in the elementary school settings. And this variant, as far as I know, it's not really, but not really specifically just infected the small children at this moment. The viruses actually do not just distinguish such the age groups. So but because those groups are not vaccinated yet, so the chances are actually to increase in the case of the children and adolescents, and of course the people in their 20s and their 30s.
Right. Meanwhile, Dr. Spector, I believe there's been a surge in COVID-19 infections among children in the US, with these cases accounting for 2% of total cases back in March and 24% in May. How do you explain this rise?
Well, I think it's a combination of events. The first is that the Delta virus is certainly circulating more in the US and is slowly becoming the dominant virus. And in fact, approximately 30% of the cases are now the Delta virus. And because it's so highly transmissible, those people who have not been immunized are more likely to become infected. So what you're seeing is a combination of things. One is that the Delta virus is spreading more easily than the other variants. but that the people who are becoming infected are those who have not been immunized. And because fewer children have been immunized, in the US, only those children who are older than 12 years of age are now eligible for the vaccine. Those children who are less than 12 are more likely to become infected because they have not received the COVID-19 vaccine.
Right. Dr. Che, as mentioned earlier, COVID-19 infection among children is also a reality here in Korea. How severe is this situation here on the local front?
So since there was a fourth wave of the COVID starting a few weeks ago, there have been some multiple clusters of cases in children attending the elementary schools so far. So this was kind of have been shown in the other countries like in UK or in the Israel after the vaccination has been taken place for the adults. So I think it is quite assumable that proportionally the children portion among the confirmed cases can go up. And it is also important to note that children still account for less than 10% of all cases, and less than 10% of all cases who gets COVID, they are getting from the school. So it's very, very minimal, I think.
I see. And Dr. Kim, what are the risks of severe illness among children as compared to their older counterparts that would be adults?
Well, so far we have known the very low incidence rates for the children and the adolescents. But in fact, according to the recent CDC report, the fact is that the case is not actually. The reason for so low incidence rates is that actually the children so far is they are less exposed to some pathogen risk the source at this moment. Like the school is closed and all just the classes are just doing by just online just education, and also even just some diagnostic tests was not really done for the children and adolescents. But in fact, in terms of infection and then the symptomatic, just the illness, it's actually just this group of people are actually just comparable to those of some adults. So that's the simplest thing. And in terms of just the symptoms and the diseases, it is pretty well known that this group of people, the children and adolescents, is mostly asymptomatic, or even there's any symptoms, it's a very non-specific, just mild disease. But we have to actually keep in mind that the children are, well, they are actually at the very low risk, but they are not at the no risk. So some children actually still just at the risk, especially the children with some underlying some conditions.
Right. Dr. Che, a UK study shows the survival rate of those under 18 from COVID-19 is 99.9%. What are your thoughts on this?
Right. It is very true that COVID is much less severe in children when compared to the adults or those who have the risk factors. So most of the children who get infected have no symptoms at all or have only minimal mild ones. But still there are complications, although very rare. That is called the multi-system inflammatory disease in children. We call it MIS-C. That accounts for around less than 1% after recovering from the COVID. So far in this country, there have been no cases of death among the children aged 0 to 19 who got COVID. But so far we had 6 cases of MIS-C cases. But thankfully all cases have recovered without any serious complications or sequelae.
I see. Well, that is good to know. But on a somber note, Dr. Spector, I hear children are more likely to experience a longer period of COVID-19 symptoms than their older counterparts. Could you explain this phenomenon for us?
Well, I think one of the challenges here is that children, although they're less likely to have symptoms associated with COVID-19, when they do, it's associated with an inflammatory reaction. And as you've just heard, the major complication is this multi-system inflammatory disease. And so when children have this long haul and they have extended symptoms, it's likely because there's a continued inflammatory response. And that is likely because children in general have stronger immune systems and will make a strong immune response to a viral pathogen such as the SARS-CoV-2 that causes COVID-19. So it's this inflammation and this consistent inflammation that is likely the cause of the long haulers. And importantly, that is seen in children who have been hospitalized. It's not seen in those children who have mild symptoms. It's usually seen in those children who have been hospitalized.
I see. Meanwhile, Dr. Kim, there are some who fear that active inoculation of the adult population may result in cases heavily concentrated on the young. How do you respond to these fears?
This actually reflects the sort of just the positive effect of the vaccination in the adults group, and that they are adequately just protected by the vaccination, but the teenagers and children are not. So this is the sort of just reflect some disproportionate effect of the vaccination only for the adults at this moment.
Right.
Yeah.
Let's move on to the treatment front then. Dr. Che, do tell us a bit about the treatment arrangements for children here in Korea.
So we have had this new policy of having the children not get admitted to the hospital whenever they have the COVID for certain conditions, like those who are under 12 years old, who does not have any symptoms at all, or who have only mild symptoms, who can be stayed at home and get treated. So those are the policies that we have in this at this moment, because this official position that to keeping the children away from the hospital without using utilizing the medical supplies or resources, we are doing it in the one condition of to monitor the children through the telephone calls from the public health centers at this moment.
I see. So there is telemedicine for children patients then?
Right.
Okay. Dr. Spector, what can you tell us about the COVID-19 treatment arrangements for children in the US? And I believe that there are separate guidelines for children who've been vaccinated and then been infected with COVID-19. Could you tell us a bit more?
Right. Well, again, very similar to adults, children with underlying conditions are at greater risk for having complications with COVID-19 than those children who don't have these underlying conditions. So children who are immunosuppressed, those who are receiving chemotherapy, children who are severely overweight are at greater risk of having complications of COVID-19. And those are the children who, unfortunately, are the ones who end up being hospitalized. As far as for children who are exposed to COVID-19, the quarantine requirements, as an example, are the same for children as they are for adults. So the US CDC recommends that optimally, after an exposure to COVID-19, and that means a real exposure within an enclosed room for greater than 15 minutes, that those children should be quarantined for 14 days. It's been decreased in some places to 10 days. And if you're tested after your 5-day exposure and you test negative by the PCR assay, at 7 days, you can leave quarantine. And again, that's the same for children as well as for adults.
I see. Generally speaking, Dr. Kim, what are your thoughts on the need for vaccination of older children against COVID-19?
Well, concerning that question, we actually think about two different levels. On the some domestic levels, I think the vaccination of the children is very important, like a flu shot. I mean, for example, like a flu shot. But we need some rigorous clinical trials for that vaccination for the children and adolescents. So far, the clinical trial result was pretty much successful for the age above the 12 years. But then we need some results. The results for the below the age of 12. Once we just confirm the efficacy and the safety of the vaccines, we can just, the vaccination is just the best choice we can try. But on the other hand, in the international level, we actually think about some the equity of the vaccines. Some countries actually, they have an abundant supply of the vaccine, but others actually, they experience a shortage. So some global concern is that if we actually cannot just control the viruses on the global scale, maybe just the variants such as like a Delta and other variants might just emerge. I mean, in the end, and that might just affect some certain countries, even just that they are already vaccinated. So far, the vaccination is pretty successful, even for all the variants that have been reported so far. But then who knows? And then what I'm thinking is that. If we just attain the very substantial level of just the vaccination for like the others and even just for the people with the high risks, maybe we can just think about some distribution, some fair distribution of the vaccines for some global scale.
Right, and provided that there are enough supplies, Dr. Che, what are your thoughts on Korea lowering its age requirement for COVID-19 vaccination to 12?
So this is actually an evolving topic at this moment. And people, even the experts, have different opinions of vaccinating the young children against the COVID at this moment. So for any pediatricians or any health system to decide whether or not to give the vaccine to the child, we need to answer a few ethical questions that must be asked. I think so first, if the vaccine the benefit would outweigh the risk, or the second, if the vaccine is in the short supply, just like as Dr. Kim has said, would someone else need it more? So some says that we should not yet roll out the vaccines to otherwise healthy children at this moment. And some says that vaccines do protect the children themselves from getting the risk of the harm and the death from the infection, and you can protect transmit it to others, and it'll be the best way to promote the children's well-being by minimizing the restrictions from the quarantines. So in this country, we are working on to assess the current best available evidence to guide us if the COVID vaccines are good for the young children. I think we probably get the answer by the end of the next month in August.
Dr. Spector, inoculations of children and teenagers 12 and above is taking place in the US. What is the response to this, and what are your thoughts?
Well, I think so far the response has been quite good, that there have been large numbers of children who have been immunized. Many of the families are very interested in having their children go back to school safely. They're interested in taking part in athletics. They're interested in socializing, and so that in many areas, there has been excellent uptake of the vaccine for those children who are 12 years and older. Unfortunately, there are pockets within the US where the vaccine uptake in adults has not been as good as in other places. And in those same areas are the ones in which those who are over 12 years of age are also not getting immunized at the same rates. What is clear, however, is that the vaccines work extremely well, and that when you look at the mortality that we have seen of COVID-19 in the US, 99.5% of the cases are in people who have not been immunized. That is a strong testament to the fact that these vaccines work extraordinarily well, and that when they are available, that regardless of your age, you should be immunized when your turn is up. Now, having said that, you do have to prioritize. And so if there is less vaccine available, you want to be immunizing those people who are at highest risk. But keep in mind, as an example, in Korea, from what I understand, there are 5.5 million children who are less than 14. If in fact you do not immunize that population, you have 12% of your population that potentially is getting infected. You continue to spread the virus. You increase the risk that, in fact, you can develop new variants. And we don't know what's going to happen with those new variants. So again, when the vaccines become available, this is really an opportunity for people who have access to the vaccine to get immunized.
Right. And keeping Dr. Spector's words about the importance of vaccination in mind, Dr. Che, do tell us a bit about the precautions then related to COVID-19 vaccinations for older children and young teenagers.
So currently we do not have any vaccines licensed for children aged less than 16 here in Korea. But we are expecting 1 or 2 vaccines that will be licensed in coming months. So in current situation, we now have some updates on the vaccine safety, especially the age difference in having the risk of the condition called myocarditis, or it's the medical term for the inflammation of the heart. So which seems more significant in the children, although the numbers were not many to confirm it. So I think we should be vigilant in monitoring the upcoming safety data in terms of the vaccine safety issues, and weigh between the risk and the benefit from children getting the COVID vaccine, especially in the context of the other situations in Korea. So other current evidences we see is that children with the medical complexity, like the genetic, neurologic, or metabolic conditions, or with the congenital heart disease, might have some increased risk of getting the severe illness from the COVID. But otherwise, we do not have this risk-based vaccination policy for the children population at this moment.
Right. The myocarditis cases that you mentioned, are those linked to the mRNA vaccines then?
Right.
Right. Dr. Spector, US health authorities have announced that vaccinated teachers, that is, and students no longer need to wear face masks within school buildings. What are your thoughts on this?
Well, I think, again, what has been shown is that the vaccines are incredibly effective in preventing disease, and certainly in preventing hospitalization, serious illness, and death. Given that, if in fact the children who are in the classroom and the teachers have been immunized, the risk of transmission is low, and the risk that the children or their teachers will become ill is extremely low. So the CDC has recommended that in those situations where teachers and students have been immunized, that masks are not necessary. Now, that again is a recommendation, and not every state in the US has said that they will follow that. As an example, in California, there has been a decision, at least to this point, that students would continue to wear masks. Whether or not that will change this fall as more and more students become immunized, we'll have to wait and see.
Right.
But currently, based on the scientific data, it would seem safe for both teachers and students who have been immunized not to wear masks.
Right. Meanwhile, Dr. Kim, inoculations for those under 12 are currently impossible. Having said that, what containment strategy do you propose to better keep this age group safe?
Right. Although they are not actually eligible for the vaccination at the moment, I think decreasing the viral load on the community level is still important. So the vaccination for the people with some high-risk group is still very important. And also some personal quarantine guideline is very important. We are always talk about the masking, the wear masking, and then the physical distance. But I want to just specifically emphasize people have to be very careful when they eat and then also drink, and also the ventilation. Especially in this hot summer, people try to stuck inside with just air conditioning on. So we need to very frequent ventilation, and then avoiding lifting up mask, especially for eating and then drinking.
Right. Dr. Che, authorities here are planning to fully open the academic arena this autumn. Is this a feasible plan in your view?
So we do have this data that we see very limited transmission within the school. We have less than 10% of the children who get infected from the school among all the COVID cases in children aged from 0 to 19. So we have this setting of very vigilant infection control measures in all public and private schools across the country. So I think the schools can be safely opened. which is very important for the children, not only for their health outcomes as a child, but when we consider all the disadvantages in vulnerable kids that can affect for the rest of their lives. I think it is very important, and many health experts and the education experts would agree with this. For the vaccine strategies, I would weigh more on the evidence-based policy making. Not just that, but we should also listen to the children and their parents or guardians, how they think about vaccinating the children in Korea. So we need the both voices from the expert group and the general public.
Right. All right, on that note, Dr. Che, thank you very much for being with us today. Dr. Spector in the US, thank you very much for joining us live at this particular hour. And Dr. Kim here in the studio, thank you for your thoughts. Right, here on the local front, social restrictions have also been raised for regions outside of the Greater Seoul area as infections have been persistent. Now, do seek to refrain from unnecessary ventures outdoors. Thank you for watching.